What I find in terms of the difference between conventional medicine and naturopathic is we all want the best for our clients and patients, but because of how medicine is currently set up in that it's a very time-driven, they don't have the opportunity to really look at the biochemistry and physiology that's driving the suffering. And so they're really trying to find packages that fit many people at once. And so that's why they're prescribing antidepressants, SSRIs, serotonin, even though there's many neurotransmitters that can cause a depressive-like state. We all use the hammer that we have, and so they're using one, which is very important and helps stabilize many people, but they're not looking for cause.
Thank you.
Hi, my name is Will Engelhardt. I'm a fourth-year medical student, naturopathic medical student at Bastyr University and an acupuncture student. And I'm wondering, Dr. Allott, if you can share with the group what is the most dramatic change you've seen in a patient with your interventions?
I had one mental health professional send to me a young gentleman who is about 25 years old. This was a very skilled therapist, and she said that she didn't believe that his depression was due to a neurological problem. She didn't think that drugs would help, but she couldn't really name why. Her experience told her that. So she sent him to me, and I did an intake, and he was a vegetarian, and I see many vegetarians, but he was pretty much eating dairy as his protein, and when I calculated how much protein he was getting maybe a third of his needed protein. As a consequence, he had been unemployed for a year. He had no sleep schedule. He would sleep 2 hours here, 2 hours there. And I suggested that he increase his protein intake, but he didn't like eating beans, and he didn't like eating grains, and he pretty much only liked dairy. And he didn't believe that he wasn't getting enough protein, which is common for somebody in a depressed state. And so I did some laboratory exams to show him that he really wasn't getting enough protein, and then put him on a higher protein diet. And within a month, he had a sleep schedule, and he was employed and making a significant salary. He came to me and said that he was still depressed, but he could see the light at the end of the tunnel. And I said, well, continue with therapy, because there were some significant reasons emotionally for the depression, but if he got stuck, to come back, because there were some other things that I thought were contributing. But for now, he needed to explore the new world with just protein.
Hi, I'm Brandy Webb. I'm a third-year naturopathic medical student and first-year midwifery student at Bastyr University. Dr. Allott, could you please discuss the rate of full recovery in your practice? Do you feel like it's feasible to wean patients off of drugs, or do you feel like management is your main goal?
It depends on the person. I treat the individual. Some people, I think full recovery is absolutely available. And it often depends on many factors that are happening in people's lives and what the priority of their life is. For some people, the priority is not reasonably to be off drugs. For instance, I have one patient who is a fairly high-powered executive, and actually working a 40-hour week is just not a goal of hers. She will probably always be on some type of med, and management is really what she's looking for, and she's fine with that. And I don't think that there's any shame in that. And I think that one of the things I work really hard to do is address the shame around being on psychotropic drugs versus having shame around being on hypertensive drugs. We don't have the same shame quality. So it depends on the individual and what their individual goals are.
Hello, my name is Benjamin Lynch, and I'm a fourth-year naturopathic student at Bastyr University. And Kristen, Dr. Allott, I wish I had some more protein this morning because I'm nervous. So I guess maybe that would have helped. I can see that naturopathic medicine could be really useful for mental illness, and mental illness is such a vast term. It's just umbrellas many things. So what would you tell the viewers, that you think the top 3 mental health conditions would be the most successful using naturopathic medicine or Chinese medicine?
The 3 that I've had the most success for are addictions, anxiety, and depression. And ADHD is another condition that can be successfully treated. And how I tell my patients that I work is, as I get to know them, I'm looking for the model that best fits them. May that be the perspective from a naturopathic model or from the perspective of a Chinese model. Both the model of naturopathic medicine and the model of Chinese have wide array of tools to address anxiety, depression, and ADHD, I include addictions into that. And I treat the individual with where I get the clearest picture. So if I get the clearest picture from the Chinese model, I start with the Chinese model. If I get the clearest picture for the anxiety or depression or ADHD from the naturopathic model, we start there.
Thanks a lot, guys. Those are some great questions, and we're ready to move on to the next section of the show, which is call-ins. So let's go to the phones.
Hello.
Hello.
Hi, my name's Sharon, and I had a question. I had a friend who had some, schizophrenia or bipolar or something like that, and she said that she saw a naturopath and they gave her vitamins or something, or some kind of, ortho medicine. Have you ever heard of that?
She's probably referring to orthomolecular medicine or functional medicine, which is a type or a subcategory of naturopathic medicine in which we are looking at the biochemistry and physiology of the individual. I'm sure that she was given some sort depending on her condition.
Great. Yeah, I didn't quite believe it, but it helped her a lot.
Good. I'm glad to hear that.
Thanks for your answer.
Our next caller is Jane from Seattle.
My question is, how did you choose which theory in Chinese medicine to use to treat mental health?
Well, I use an eclectic array of theories for Chinese medicine. For those of you who are familiar with Chinese medicine, there are several different schools, and I kind of integrate several of those. Often my diagnosis comes from pulse and tongue diagnosis. A lot of practitioners will feel your qualitative pulse. The sensation of the pulse gives us a lot of information, and also what your tongue is shaped like and the texture of the coating on the tongue makes a significant difference in terms of how we view you. And people are like, oh, how could that be? And an example of this is I was treating one patient with back pain. I have a couple of patients who come to see me for physical pain because acupuncture is very good for that. And I was taking her pulse and I was like, did something bad happen this week? Because the quality of her heart pulse was very changed. And she said, no, everything's fine. At the end of the appointment, she's like, actually, my husband is in the doghouse, and he is really in trouble. And I said, well, you better decide what you're doing with him in terms of if he's ever going to get out of the doghouse, because it's beginning to affect you.
So you're a licensed acupuncturist, and your practice is where again?
It's in Aurora, in Seattle.
In Seattle, okay. So that's in North Seattle. What time are you open?
I'm open Monday through Fridays. Appointments vary from 10 a.m. to 7 p.m. depending on what day of the week it is, because I try and accommodate people's work.
How would somebody get a hold of you if they were?
Usually they get a hold of me through referral. You could also reach me at my website, which is www.dynamicpaths.com, and that's paths with such as Peter, Alpha, Tom, Harry, Sam, because sometimes people don't quite hear the subtleties of it, .com. I also can be reached by phone, which is 206-579-2757.
Okay, well, that's all the time we have for today. I want to thank Dr. Kristen Allott for coming in today. Thank you very much.
Thank you very much for doing this. I think this is really a great opportunity for naturopaths and acupuncturists as well as the public to learn about the power of the medicine that we have to offer you.